Oklahoma averaging more than 2,000 new cases of COVID-19 per day, as more than 2,800 have been confirmed on this Friday.
Hospitalizations still on the rise, up by 72 over the last 24 hours, while 19 more Oklahomans have lost their lives to the virus. And tonight, terrifying new information about COVID-19's impact on our children.
An Oklahoma doctor predicts as many as, listen to this, 80% of elementary age kids will be impacted within the next 2 months.
News 4's Kaitor K on the story. And Kaitor, new variants are of particular concern here.
Yeah, doctors are terrified of the harm the Delta variant and even future variants could have on elementary students who aren't yet able to get vaccinated. The study they're citing predicts the vast majority of them will catch the virus if they're not masked and regularly tested.
We're really concerned about the elementary and the middle school children who cannot be vaccinated.
President of the Oklahoma State Medical Association, Dr. Mary Clark, sounding the alarm on the urgent need to protect kids 12 and under from the latest variants of COVID-19.
There is no protection for them at all except for a mask and making sure we try and socially distance as much as possible.
Citing a CDC-funded study painting a grim picture of elementary schools that don't mask students or conduct regular testing. According to the study, 80% of students who are unvaccinated or who have not already had COVID will catch the virus. The study out of North Carolina State University projects that 90% would be infected by the end of the semester if the precautions aren't taken.
It is very striking.
Dr. Clark saying she's trusted models like these since the pandemic began.
So I would not expect these data to be any different. That if you do what's right, the numbers will be lower and hopefully our models look different.
With the Delta variant spreading fast and other variants looming on the horizon, she says mass vaccination is the best path forward.
If we get everybody vaccinated today, let's say we could, that would immediately stop the spread of a virus. And if it's not spreading and not multiplying, it cannot mutate into another variant.
Dr. Clark says that vaccination for kids 12 and under is coming soon. Children as young as 6 months should hopefully have access to the COVID shot by this fall or early next year.